Hi, everybody. Welcome to another episode of ASAP Pathway Podcast. I am your host today, Dr. Stacy Ochoa, and I am honored and really excited to have a conversation with my friend and colleague, Dr. Susan Maples. And you'll see why once we get this conversation going. She's just an amazing person. And I actually met her for the first time. I'd heard about her over the years and met her for the first time at the American Dental Association's Pediatric Airway Symposium this last summer. And I just was dumbfounded watching her speak. And I think my mouth was hanging open the whole time because she's just so amazing and she's inspiring. And I'm honored to call her a new friend in my life. But I'd love to do a little introduction so you all know a little bit about Dr. Maples before we dive into this conversation. Dr. Susan Maples leads a successful insurance-independent total health dental practice in Holt, Michigan. She brings preventative and restorative dental expertise, a passion for mouth-body total health, a master's degree in business marketing, and 35 plus years of experience in private practice. In 2012, Susan was named one of the top 25 women in dentistry and one of the top 8 innovators, otherwise known as disruptors, in dentistry. Susan is the immediate past president of the American Academy of Oral and Systemic Health. She's the author of Blabbermouth, 77 Secrets Only Your Mouth Can Tell You to Live a Healthier, Happier, Sexier Life, and recently finished a new book titled Brave Parent, Raising Healthy, Happy Kids Against All Odds in Today's World. She's the developer of the Hands-On Learning Lab Kit, an interactional science-based learning program for dental patients, and selfscreen.net, an educational screening tool for patients and clinicians to uncover signs of illnesses such as prediabetes, diabetes, obstructive sleep airway disorders, acid reflux, chronic systemic inflammation. Susan was a co-investigator in an award-winning diabetes research study entitled Diabetes Detection in the Dental Office. She's also the creator of the Total Health Academy, which is a robust online learning curriculum for dental teams to develop a complete oral systemic dental practice. And without further ado, welcome, Dr. Maples. Welcome, Susan.
Thank you. Thank you so much. I'm so excited to be here. And I'm also a big fan of yours. So
Oh, my goodness.
Privileged right this minute.
Well, thank you so much. Not many people are talking about the topics you talk about, and when I was listening to you, I was like, oh my gosh, not only are you dynamic, you're engaging, you're just effortless when you speak. And I mean, really everybody at the table when you were speaking, I kept turning to Lauren Bollinger and we were just like, oh my gosh, she's my hero. I mean, you're just an amazing speaker. You reach out to the audience, you engage. But your topics, they're not discussed enough. I mean, and I am very much into, in the airway movement, we talk a lot about anatomy, craniofacial respiratory system. We talk about the anatomy a lot, and it's important, but we're not talking enough about
lifestyle
and gut health.
Bill Hang just hired me to speak inside the Hang group, which is really
wow,
about orthodontics and orthotropics, which is an amazing course. So I was just so tickled when he reached out and said, could you come and speak inside here? It is, and he wants me specifically speaking about that. But when you say we're not talking enough about it, it's so true. I don't know if you remember, a few hundred years ago, there's this little song called Dem Bones.
Yes.
To the ankle bone,
the ankle bone's connect.
Shin bone, the shin bone, and on and on and on. And this is the deal, right?
Yeah.
We are so integrally connected. So when you think about, for instance, airway health, we fail to look at gut health, which is where autoimmune disorders and allergies are caused. We can talk about allergy face, but what about the allergy itself, right? We know we facial distortion when we have the chronic stuffy nose. We kind of can figure that out. But if all the tools in our if all the tools in our toolbox are about changing the anatomy because we're capable of that, if all you have is a hammer, the world looks like a nail. And what about looking at the root cause while we get a chance to pound the nails in, right? So
Right.
that's part of like what we're expected to do. And in the history of medicine, it wasn't till the late 1700s that we divided the body into systems, and we gave the heart to the cardiologist and the kidneys to the nephrologist and the skin to the dermatologist, and the entire mouth went to the dentist. Unfortunately, the medical world, who studies inside the medical school, they get to circulate at least an introductory look at all of those systems that I talked about at first. The silo for the mouth, though, is way over in the dental school, and the physicians in training don't get over to the dental school to learn anything about the mouth.
A
So,
really good point, Susan, is just the lost connection between, our medical colleagues and us.
So if you look at airway in particular, 85% of pediatric people who care for kids in the pediatric medical world, family docs, OBs, pediatricians, 85% are not recognizing sleep and breathing disorders. 76% of physicians for adults, unless someone comes in and says, look, my wife can't sleep or my husband can't sleep because she says I'm gasping at night or something, then maybe they need a sleep study. But they're not using the mouth, the anatomy, to be able to see obvious signs like deep overbite, melon potty score, vaulted palate. Like it's so clear to us once we see it. We don't get to see it, but we also need to help our medical colleagues see it, and we need to learn what we can from them in terms of looking at everything from acid reflux to, there's just so much, there's so many complicated pieces that go into.
Yes. And this is the point too, when people want a cookie cutter, I just spoke at Transform Dental Sleep, and there was a Q&A section after I was on the stage with a pediatric neurologist, sleep neurologist, and which was she's brilliant, Anne Marie Morris. She's great. But I understand everybody wants a simple answer. We all want a simple answer for a very complex situation, but there's a lot to unravel, and people are like, what's the best device to use to fix sleep apnea? Like, oh gosh, and it's not even just sleep apnea, right? It's sleep related breathing disorders. I mean, only 5% of children, projected, have full blown end stage disease, obstructive sleep apnea. But all the children that have upper airway resistance and sleep issues and sleep fragmentation and mouth breathing and snoring and asthma and
not to mention ADHD, which is
ADHD, yes.
Right.
I mean, let's look at that population's huge.
But you think about ADHD, let's just take that for example. ADHD is a group of symptoms, like fibromyalgia is a group of symptoms, right? It's we make diagnoses not based on a sleep study like upper airway resistance syndrome or obstructive sleep apnea. It's based on, which again, we could get into the data collected for that and wonder where we are with that.
Agreed.
So many kids with UARS, we're not able to really detect that. But let's look at ADHD. We know that the symptoms that come with ADHD, where you have a child who's defiant, who's easily distracted, who has difficulty learning, who can't, who isn't keeping up with cognitive development, or at least in schools. These are the exact same signs that a sleep deprived child has. Mm-hmm. And when adults get sleepy during the day, they tend to nod off. When kids get sleepy, they fidget, and
to prevent themselves from falling asleep.
Yes. So we look at this disorder, and then we say, well, they have enough of the symptoms. We can check enough boxes to medicate them. And then we medicate them with a stimulant, which is perfect for someone who's sleep deprived, right? Of course, they're going to feel better. But by medicating them with a stimulant, we also know that the half-life of those drugs doesn't behave well enough so that they get more restful sleep at night.
Right.
So we're covering symptoms, but we're not changing that. And in my research in Brave Parent, I also learned that sadly that kids who are prescribed stimulants for ADHD have a much higher propensity toward recreational drug abuse and addiction later, because they're becoming accustomed to a change in their mood or behavior based on a drug they're taking. So these are things that we think have long-term ramifications. Short-term fix, long-term ramification. Let's stop throwing meds and start fixing some of the root cause problems. Not to say there's not room in this world for medications like Adderall.
Right. But let's not make this kind of this patch or crutch kind of, that's it. We have to look beyond that. I mean, just like, some children might need a CPAP for a while or but that's to say that is what they're going to have the rest of their life. Like, is there any way we can change that? Like, let's just investigate beyond currently what we're using to manage symptoms and get to more of the root causes. Let's look at the craniofacial structures. Let's look at gut health. I mean, I speak a lot about vitamin D health, the B vitamins, how vitamin D is a bacterial growth factor for the gut. And those B vitamins then go on to give us our neurotransmitters. I mean, it's funny. I was having a conversation, and I'll have to introduce you to Anne-Marie Morris. She's great. I had her on, and we were just talking about, we dove into gut health a little bit, and she went into, somebody that has sleep-related breathing disorders. It actually affects the gut, and then the gut then makes worse sleep, right? So it's this vicious cycle. Like, you can literally see the gut health of someone that has sleep apnea and all the things downstream that happen because of that, and the inflammation and the hypoxias. Like, literally, a poor gut can cause hypoxia, and it's like, wow. And she goes, really, when she started diving into the research before she did, she was like, how important can all these crazy bugs be with our sleep health, And she's like, they have everything to do with our sleep health.
And unfortunately, as a society, we've knocked down the diversity of our gut bugs about half in 50 years, which is unconscionable. And there are some very significant reasons for that. That has increased the level of allergies through the roof, autoimmune problems, asthma, the whole allergic progression from eczema to the chronic stuffy nose to full-blown allergies to asthma. And when we think about the root cause of that, it takes me right back to the number one reason. This is the lack of diversity of food, not just what you buy in the store, but in the food supply in general. If you're eating if parents are bringing home ultra processed food, you're kind of screwed. I don't know how to say it, but we are, and I know I'm going to use a very strong word. I think that the food manufacturer, I think it's a predatory system. I think that the food manufacturers are making a shit ton of money.
Yeah.
Backs of our health. And I think it's unconscionable. And I don't know how to fix it. And I don't know which, I'm sort of middle of the road politically. So I can listen to both sides and not get excited or upset about
it.
But I don't, I try to look at situations like this as a problem that needs significant brainstorming, not a political posture. If we're looking at socializing healthcare, are we not looking at trying to put a kibosh on how much sugar comes out of the grocery store or in the products, or not just sugar, but ultra processed food? There was another article, another good study a couple months ago showing 24% increase in risk for oral, pharyngeal, and esophageal cancer just from 10% more ultra processed food. We're
Good grief.
Emulsifiers, thickeners, flavorants, colorants, plastic wrappings, all of the stuff that we sort of take for granted. If you're buying stuff out of a box or a bag, you're going to deplete some gut microbiome. And that doesn't include over sanitizing our world and not playing outside and not having So we're really down a different rabbit hole, Stacy, but we're pointing out how difficult it is to solve a problem with an appliance or
Thank you. Yeah, it's beyond that. Can an appliance be a piece of the puzzle?
yes,
Sure, it's
malfunction,
a piece,
all that.
but
Yes.
you have to pull back and look at the macro issue. If all we're doing is, I love that picture of when everybody's staring at an elephant and they're all describing the elephant, and someone's looking
Right.
at, and someone's looking at the tail, and someone's looking at a trunk, and someone's looking at their foot. You just
Yeah.
got to look, you have to pull back and say, okay, this has been going on for decades, the Industrial Revolution. And I mean, we have a huge problem, and it's like, gosh, like you said, we don't know how to fix it, but I love your approach because, um, well, I wanted to get into a little bit before we go into just how it took you down this path. You had your own personal journey that made you start stepping back and going, wait a second. If you wouldn't mind sharing just a little bit of that, like what got you
So I
on
was
this
born
path?
in an unusual time. When I was a little girl, about the age of 8, was the first time the American Cancer Society came out and said smoking was dangerous to your health. Smoking causes lung cancer. I mean, so I was born before that. When my mom carried me, the doctor told her it would help her anxiety to increase her smoking.
Oh,
My
wow.
mom and I were only 13 months apart, so she had a baby in arms when she found out she was accidentally pregnant and freaked out and doubled her smoking while she carried me. So I came out of the womb. Also, this is before a time where we ever talked about secondhand smoke as being harmful to anyone.
Right.
I mean, I know that you could have smoke damage from being in a house fire, but no one ever thought about the house fire coming from the cigarettes, right? Um, so we had, I was born in an oxygen tent with some early development and premature lung development. And I spent 3 months there, came home, and every time I would go back to the hospital with blue lips, it was another ordeal. But by the time I was 1 year old, I could stay home, but I developed um, that whole allergic path, right? So I ended up with 52 allergies and allergy shots twice a week, slept with a vaporizer with allergy medications, had exercise-induced asthma, had rescue inhalants, all this stuff. And I struggled a lot as a kid, and I felt so guilty that I chewed up so much of my family resources, tears, time, money. I felt like the problem child, and I was sick,
Yeah.
right? And I would go to the allergist or I'd go to get my allergy shots twice a week with my grandmother, and we'd stop for ice cream afterwards. That was my favorite memories, and like couldn't do a lot of activities. I ended up getting overweight. I was pre-diabetic. They didn't call it that then. They called it borderline diabetes. So I had that glucose tolerance test twice a year. They were trying to decide whether to put me on insulin. This is all lifestyle related. And I had a physician at the age of my adolescent years, 8th grade, 7th grade, who I met for the first time, who um, helped, who she was an internist. My mom found an intern. My physician, my pediatrician gave up on me and said she needs somebody for sick people. And they didn't have pediatric internal then. So she was just out of residency and was able to help me regain my health through a lifestyle change, significant lifestyle change. And she met with me weekly. I mean, it's just an unusual savior story, but she was there to help me learn how to fix myself through exercise, and which I couldn't do then. But she took me one step at a time, and then also diet change. And my mom ended up quitting smoking, and my dad and mom were divorced at the time, but my parents wanted me to be healthy. They partnered together as co-parents in a divorce situation very well for us, for their kids. And they were participants, but I mean, I was literally doing the grocery shopping in the 8th grade with panniers on my bike. Like
Mm.
I was cooking and learning how to, and the closest little store was this little Asian hole in the wall market. And these Asian women were teaching me how to make dinner. And I would take this produce home and I got into like cooking, Asian cooking. It was pretty interesting, but
Wow, it is interesting.
yeah, but I was literally, my family was like grateful, and I regained my health and got rid of all my allergies, became a competitive athlete, never had a weight problem. And I to this day am super, super grateful for all of that. But I also know my story is an unusual one, but it's a story that is translated into care for my patients, because we're the only ones, Stacy, who see people presumably well every 6 months. And I don't really agree with the 6-month prophy. I think that those intervals on preventive visits should be personalized. Some people
Agreed.
we only need to be seen once a year, and some people really need to be seen again next week, or the week after, like my doctor did with me. Um, or, we again say all perio patients are 3-month recall. It's like, what does this person really need from me?
How can I support my patient best? And it's so driven.
Right here.
It is. And, I guess I've always heard that I guess it was a Crest commercial or something. It was the one that came out and said, see your dentist twice a year. Like that's where the 6 months, every 6 months comes from, some Crest commercial, right?
Accident. And what's interesting, it also said, see your dentist twice a year, brush your teeth twice a day, which we still tell people. And the third part it said on there is eat correctly. And we don't ever talk about
Well,
it.
that's never talked about.
Yeah.
I mean, even when it's interesting because I try to be extremely on purpose, let's not be tooth mechanics, right? We're better than that. We're trained so much more. We know so much more than just getting in there and repairing holes in teeth and active decay. Like you see the train wreck, the fire in your patient's mouth. And it's like, you got to pull back and say, let's talk. Like, let's talk about how you got here. What's your diet like? Tell me about your day. What do you have for breakfast?
So I'm going to tell you, I bought a practice at 25 years old and I'm 64. So do the math. I've been there 38 years and I've seen the train wreck from little kids to adulthood, for everything. I've been to 9 funerals for drug overdose for young adults. I can't say I've seen it all. I've seen a lot. And half of our patients are referred from the medical community. Half of them are pretty sick. We do get a lot of people on a wellness track that are really just trying to tweak things and make sure everything is just in, they want salivary diagnostics and they want to know, what's going on. But we have an interesting opportunity in dentistry to partner with people. We have time. Medicine's lost their way. They've lost their way. There's 7 minutes face to face. They have a huge shortage of health professionals for the onslaught of disease. We are in the midst of the most significant health decline the human race has ever seen. And it's from non-communicable lifestyle related illness. And so, of course, they're overwhelmed. And of course, they need a quick fix. So the more the pharmaceutical companies can come out with quick fixes to cover up symptoms, the easier it is for those physicians to do those turnarounds. And we're not a lot better. We're basically there diagnosing holes in teeth so we can also do the quick fix.
Exactly. Right. We've got to change this paradigm.
While the fire is still burning. Like what's up with that?
Yeah, it is. And here's the other thing too, even in dental school, I mean, obviously we learn, bacteria plus sugar secretes acid. I mean, but what about, we don't get the education we're supposed to get, and like to really have these conversations of what is a healthy diet? How can I help this patient? How can I just walk alongside them in their life with their family and guide them to a healthier lifestyle that not only is going to help the oral environment, but their entire body that their mouth is connected to. When did you start getting into gut health? Because you are really knowledgeable with gut health. And when did that start?
I want to just back up for a quick second and point out what you just did there. You went from education to facilitation. And I think it's important to point that out. Education is one-way communication. We have been taught to be educators. So if you tell your patient, if you eat sugar, it activates the bacteria to spit out acid, makes holes in your teeth. That's an educational statement. Oh, really? I didn't know that. Yeah, that's called Caries disease. And here's a book on it, or here's a pamphlet or whatever. Facilitation is walking alongside them, trying to figure out, where's it coming from? What are you willing to replace it with? What are you willing to do? How's it been working for you? Those are open-ended questions. Does the tooth decay concern you?
Yeah, let's back that train up. Exactly. Like, does this even, am
Yeah.
I more worried about this tooth decay than the patient is?
And nobody really likes it, but would you be willing to talk, have a conversation about what might be different so we can change the rest of the story? Now, I just asked 2 yes or no questions. Does it concern you? Would you entertain a conversation? Those are yes or no. But really, when we get into facilitation, we lose the yes or no questions. Tell me about your diet. Tell me about what sources of sugar or carbohydrates and how frequently you're eating them. Like, tell me about that. Tell me what foods make you feel sick, sluggish, or guilty. Tell me about a day when you've eaten at your best. What does that look like? What are you, able to do? Tell me about liquid sugars. Those are conversations that have the patient leading you, and then you stay in the question with them, looking for a moment when you might drop in one piece of education. Again, education is one-way communication. Did you know that
Right.
sipping on that beverage is worse for you than drinking it down? That said, I never say that because I know that drinking it down quickly causes an insulin resistance. It causes a surge of glucose to the body, which causes the pancreas and the hypothalamus and the liver to overreact. And, also we're looking at, I'm not sure that we ever should have said that, because as a systemic approach,
It's awful. Yeah, now we're telling you to guzzle it.
yeah. And it bypasses the teeth, but what does it do to the rest of your body? So instead of saying, what else is possible for you to switch? What is it that you love about that Coke or Diet Coke? And Diet Coke, by the way, it causes metabolic change in the body, as does, the body still recognizes it as
Yes, I actually was talking to a gastric specialist, and he was telling me that what is it called? Something cephalic. It's like basically a relationship between taste, the brain,
yeah.
okay, and that insulin can still be secreted because it is the body taste sweet, and that's all the brain's like, oh, it's sugar. So
too, it is a sugar. It's so concentrated that we put so little in it, but people think it doesn't impact. But then there's the whole issue of it. There's no sugar in it. It's a chemical shitstorm.
It's so awful. And the studies that are coming out that
so acidic, the body
is so acidic.
pH.
It is just so bad for you. It is so bad for you. This is the struggle too. Oh, Susan. Our patients are busy. When we have those littles in our chair and mom or dad is in the corner of the app, they're staring at their phone, they're checking their text messages so they can hurry up and get out of the room, right?
Yep.
And we don't even know if they're engaged. And you taught me something when we were at the ADA, and when you were giving your presentation. I just even love the way you collaborate. Oh my gosh, you're just amazing. The way we ask the questions, the permission, asking the parents if they have time for us to go over the concerns we might have. And it's just, we're up against a really steep hill right now. We have so much as practitioners.
I don't know if during the ABA presentation I did this, but oftentimes I'll have my audience members all stand. And I do this because, I'd like us not to be judgmental. Like every time we have a finger pointing at someone else, there's 3 pointing back at us. We're not perfect.
Right.
So to level the playing field, I have the audience stand up. Now it's all health professionals in the audience. And I say, sit down if you don't floss your teeth. Of course, nobody sits down.
Yeah, even if they don't.
Sit down if you don't wear your seatbelt. Sit down while you drive. Sit down if you don't drink 6 to 8 glasses of clear water a day, sit down if you don't exercise at least 6 days a week for 30 minutes or more. Now you can sit down if you don't get 7 to 8 quality hours of sleep a night consistently. Sit down if you don't eat at least 5 full cups of fruits and vegetables a day. Now, these are all things we know we should do, right? By now, there's very few people standing, but there are always a couple. And then I can start to take them down too by asking about preventive visits and asking about, here's one that takes most of the audience down. Sit down if you go to bed with a drug or wake up with a drug, including alcohol or caffeine, right?
And that's when everybody's butt hits the chair.
Well, and again, there's always someone standing, but I wait and I can take everyone down, but I wait until there's one person standing. And then I say, I want you to recognize that I could take her down or him down, but I'm not going to. I want to point out the fact that there's a difference between this person and the rest of you. What do you think the difference is? And the difference is, and this I learned from my son Hunter, how they organize their time. And we organize our time around what's important to us. And so everyone will say, I don't have time to sleep 7 to 8 hours. I don't have time to chop vegetables and cook at home. I don't have, as you say, it's about time. Everyone's on their phone, their busy lives. And I have to say, we all have the same 24 hours. We just arrange it differently.
That is so true. It's time. And how do you value that time? So
yep,
it's the value of that time.
This person who's standing organizes her life differently than
yes.
And it's important to them. They put their health as a higher level of importance to make sure they get those things in. So when a parent is there, and parents often put the health of their child above their own. If they can start to recognize that their child is not growing up to be the person they're meant to be, that their child is not growing up to their full potential. And might you be willing to organize your day, your life a little differently to support your child's health? A lot of times they'll be all in, but you have to sort of say, what does that take?
Yeah. What does that take?
Yeah. I'd like to sit down and talk about some of the issues that we're seeing and what we might do. Not like you have time to go to a specialist to get an orthodontic appliance in, but do you have time to talk about how about sleep hygiene, which we often don't talk about, right?
Right.
To create a sleeping space that belongs to a child where they actually love their space and can sleep well, right?
That is so important. And it's funny when I talk about sleep hygiene with parents, because they're not expecting that. I mean, unless they're the ones that come to me for a sleep consultation, but when they come to a dental visit, a lot of these parents are, okay, I've got an hour, little Johnny's getting their teeth cleaned. They're not expecting conversations about, the ADHD meds or the fidgeting or how are they doing in school or diet. And then the last thing they're expecting from their dentist is, how many hours of sleep, what is their sleep environment like, and I think too, a lot of dentists that are getting into this, they'll say, oh gosh, now I'm coming back from this seminar and I'm going to start trying to have these conversations with adults that are my patients and parents of my pediatric patients. And they're going to say, why are you starting to ask me this, Dr. So-and-so? I mean, you've never talked about this before. What would you say to dentists listening that they're nervous, like they're learning themselves, but they want to start having these conversations? What would you say to a dentist listening that wants to really start changing these conversations in their practice? When a parent says to them, why are you asking me this? I've been coming to you for years and you've never asked me this before.
I think that there's a fear on the part of dentists and hygienists about being an expert. We love to be an expert before we open a conversation. And the fact that we don't know, when you say, oh, how did you get into gut health? And like have a dentist on this podcast thinking, I'm never going to get there. Like, I don't really want to talk about this. It opens up too many cans of worms. I think the idea that we can learn a lot from our patients just through our own curiosity, we don't have to know the answers.
I think that's excellent what you just said, because I think the culture of dental school, probably med school too, I don't know, but it is this perfectionism that is created, and you walk out thinking you have to have all the answers and know everything. And that's where we get this analysis paralysis, and we sometimes don't change because I'm really good at this. And if I have to learn something else, I don't feel as good at it. I don't feel like the expert. So I don't want to do it at all if I can't be the expert.
It's interesting. I created an interactional health history for pediatric and adult, but so that when I say interactional, it's all the questions are organized in little boxes around categories. There's one on allergies and food sensitivities. There's a box on addiction and dependency. There's a box on sleep or breathing. There's a box on sleep. And I pick out some low-hanging fruit, some questions that might stimulate them to think, oh my gosh, maybe I do brain health. Maybe I do have a brain health issue. And it opens up the ability for a hygienist to pick up a health history and say, tell me more about that. You know, there are ways that we can learn. And for people, health histories are a terrible way to prioritize because it's really our agenda, not theirs. We don't have any idea. We don't go, here's a red pen, circle the areas you're currently working on, or there are hot buttons, right? But what we can do is ask those verbal questions. And what you know is with the internet these days is that patients know a lot more about their health than you do about them. And so if there's something they're curious about and they're trying to move their life in a certain direction, and we might be able to be of help with that, those are the areas we might want to start. So asking questions, open-ended questions about what's most interesting to you about your health, about your child's health. What are you most curious about in terms of helping them be the best they can be? And then to be able to say, I'm hearing, if a dentist is insecure about talking about this, they don't offer solutions or just getting into it, just to be able to say, there is rumble among our profession about being responsible for participating in this airway discussion. And I want to be better at that. So I'm a very curious learner in that area. And I know you'll be a good teacher for me. So tell me
Oh,
what
I
you
love that.
Yeah,
I love that. It's just so, I mean, it's real. It's genuine. It's just, you're not being pretentious. Yeah.
And it's so fun to start over and learn something. I mean, I'm a pickleball addict, and how fun is it at 64 to be getting a lot better at a sport, right? So fun. And this is the way dentistry is. If I'm 64 years old and still super actively excited about learning, retirement seems pretty far off. If I am like paralyzed in my brain, I'm so ready to retire. If all I am is a bunch of hands, working with instruments and fixing teeth, it does seem to get old. But if you're learning while you go, it just keeps it so exciting.
Yeah, it changes it changes your mindset about what you are participating in, what you are doing. You're not just a tooth mechanic, you're changing lives, you're developing relationships with your patients and your colleagues and your community. And
here's what I know about you and me is at the end of our career, at the very end of our career, we'll know we have done something good for people. And I'm not just talking about getting on a podcast or writing books. I'm talking about in our daily practices. The fact that we know that there are people, whether they can put our name to it or not, that will become better humans, more creative, more excited, more energized, less depressed, less anxious as a result of what we're doing for them at infancy, 1 year old, 2 years old, 3 years old, 4 years old. These are because kids can't wait.
No, they can't.
These are when the brain is developing. These are the years that make the huge difference in who they become. So
And you have a saying, you have many sayings, but something you said at the ADA, I mean, it just choked me up. And it was basically, I'm going to just summarize it. But it was about when children walk into our practice, they're
there are,
not,
yeah.
they're our responsibility. They're no longer somebody else's kids. They
Yeah.
are our responsibility.
Yeah. I love that. And there's no such thing as other people's children. That's what you were referring to.
That's the one
Yeah.
that's it too. There's no such thing as other people's children. And I just sat there like, oh my goodness, it just hits me right in my soul, because that's how I feel when you have a child in your chair and you're looking at them and you see all these signs and symptoms and you want to help. You just have to start having the discussions, just the very vulnerable conversations with some parents and planting seeds, because not all parents are ready. They're not ready to hear it.
Different cultures around the world where communities share the parenting. And I believe I'm a surrogate parent to many kids. And I also believe that when parents choose to bring their child to me, they've invited me to be part of that parent tribe and lean in, not just their dentist, but truly to care about them in a way that looks at how can we help them reach their full fruition. And sometimes I have to have conversations with kids in front of a parent or behind the parent, doesn't matter, to say this, it's your turn to claim your own health. Like, I want you to be making these decisions for you. I don't want your, we do that a lot where we have kids. I'll even have kids go home with the Fujicate app on their phone and go through their cupboards and scan the barcodes and then find food items, make a shopping list of foods that would replace the ones in your cupboards that are more healthy.
What was this app? Fujicate?
Yes, Fooducate. You scan the barcode and gives the kid a letter grade. It'll give you the explanations and nutrition value, et cetera. But like Doritos gets like a D-, right?
Yeah.
But there are plenty of corn chips with 3 ingredients. Fritos, for instance, might be a B-, not exactly a health food. But would you rather have a B- or a D-? A B- keeps you in school. A D- you flunk out, right?
Right. So it gives them, does it give them a replacement? Because there's, okay.
It has alternatives, and then it'll start from the better grades down. So yes, they can actually it's a great shopping tool for parents in grocery stores. But I love it when kids spearhead this, because parents will be like, what did you do with my child? He's asking, like, he's not eating Jif peanut butter anymore. He wants me to buy the natural brand. Like, we're getting away from hydrogenated fat altogether.
What is that? What have you done to my child? Which is so cool, because when we were talking earlier, our kids can be our greatest teachers. And you also have a podcast as well. Is your podcast Brave Parent?
Brave Parent Podcast.
Okay. And I went on to it, subscribed to the podcast, and I went straight to the one where you actually interview your son and have him on the podcast, which, as a mother of, now I have adult children, and I'm listening to this conversation. It was very emotional for me, because I was very, as a mom, I'm listening to how proud he is of you, and I'm like, what a gift that you get to actually like interview your own child, listen to your son, your adult son, describe his experiences and his childhood and what he learned from you and how he's taken that into his life and how he's taken it and grown that. It's like every parent would love to know that trajectory of the influence they have over their kid. And I just love that interview you have with your son. And it's
one of my favorites too. And, I bring in a lot of health experts in that podcast. And I also agree that one was pretty powerful, because he's 29 looking back. Now, I, as you know, didn't grow up in the healthiest of household. I helped create that. But when I was pregnant, I had no idea what I was doing. So I hired a nutritionist someone who actually spoke at a dental conference on bulimia and anorexia, and was talking about the fine line between pathologic eating and healthy eating was the regular dieter. Now, we had just started this cabbage soup diet at my practice with my team members, and I was like, oh my gosh, what's going on? I said, could you sit down with me and teach me how to raise a healthy eater? Good relationships to food, because relationships to food in our country are pretty messed up right now. In any event, I started out with some really, really good building blocks for pillars of sanity for for raising a healthy child. But it turned out that the level of health that we adopted in our home was weird out in the world.
Hmm.
I literally got an email from the 6th grade principal who said, I had lunch with your son this morning, and I've never emailed a parent about lunch, but it was quite an experience. When he pulled out a bag of raw spinach, I had to ask him what it was. And Hunter said, Dr. Tweedy, you've never seen spinach before? He said, you're eating that raw? And he said, it's delicious. Would you like some? And then he said, Hunter, the next thing you're going to tell me is you like Brussels sprouts too. And he reached in that bag and pulled out roasted Brussels sprouts from the night before, and I about lost my lunch.
That is awesome. That is hilarious.
This is going to be social suicide for Hunter. So I went to the store, deliberately bought some potato chips, but I couldn't figure out how to get potato chips into an already full brown paper bag. So I bought Pringles, and we'd never had them. And I bought the original Pringles, and I put like a little stack in his lunch every day. I didn't tell him. And at the end of the week, he never mentioned it. And I said, you never mentioned the treat that I put in your bag. And he goes, treat? That's a treat? You call that a treat? He said, I didn't even know what they were. My friends said they were potato chips, and I held them up to the light. They looked just like particle board. I'm pretty sure that was not cut from a potato, Mom. Then he jumps out of the chair. Now he's a nationally ranked ski racer at this point, right? And I've brainwashed him to believe, as I do, that everything we put in our mouth, how we sleep, how we eat, and how we drink rules our world, right? It helps us become our full potential.
Yes.
He jumps out of the chair and he goes, this body is a rocket ship. It only gets rocket fuel. Don't try to pull it over on me. Don't try to trick me. I know that's not real food. So, hearing him in that podcast talk about a little later going into the bathroom stalls in the bathroom and eating his greens before lunch so that people didn't rip on him. And then he finally got enough gumption to say, I don't care what people say about me, right? I'm going to eat what I eat. But the point is that kids who grow up in households that focus on health, it's going to be different.
Yeah.
And as Hunter pointed out, I can eat anything I want. I just don't, we always say you can visit there, you just don't live there. So, he's like, do I ever eat a French fry? Of course we do, right? We're normal people living in the world. But
I like that. I just visit. I don't live there.
That's right.
Yeah.
Yeah. If you live there, you get yourself into all kinds of trouble.
Yeah, you do. And it was you that I first heard all this fiber, that fiber, I mean, it's basically helps with our probiotic, our gut health, our biome growth. Is it like a bacterial growth factor? Is it what is it that fiber's doing for our gut?
It is so fascinating. It's our number one nutrient deficiency, and fiber is, you can think of it like straw or hay. It is in the plant. It goes in the mouth, goes all the way down the tube, through the stomach, into the duodenum, into the intestine, comes out the poop chute, never absorbs into the body. It is a scaffold. It swells with water, and it creates a thick gelatinous mass that binds the nutrients and sugar and allows the sugar to eke out very slowly into the body so our pancreas can keep up. It keeps enough of the sugar in the plant that it also feeds the bacteria in the duodenum. So fiber is considered a prebiotic. It feeds good gut bacteria and allows growth of healthy gut bacteria. It controls, when we started out talking about if you guzzle sugar without the fiber. See, we took We took all the sugar out of the plant, threw the fiber away, and put the sugar into everything. And
Sure
that's
did.
the beginning of the problem. So if, for instance, you have a juicer and you squeeze the juice out of the fiber and throw that away and drink the juice, now we're getting the sugar without the
Without the
micronutrients,
fiber. And that makes sense.
right? So we also know that in the mouth, if you can chew the fiber instead of blending it into a smoothie, we can, we get the whole masticatory system working. So if you look at the caloric nature of smoothies, how many calories you can pack in and drink that down pretty quickly. I think that if you sat down to eat all that food, it would take you longer. And I think it's important to be able to
Chew. Yeah. We're not chewing either. Everything's in little
pouch.
pouches and melting. And I mean, people are afraid to give their kids bananas because they might choke. I mean, I'm like, you don't even have to chew a banana, and they're afraid to give a whole, let them just bite a banana and eat it. I've been telling my parents, I get it because I mean, no one, it's terrifying to think of your child choking, but what they are finding is in the cultures where children actually just eat what the parents eat, sit at the table, they have no teeth and they're ripping meat off the bone and they're chewing it with no teeth, just like the parents are eating. They develop a healthier, more toned, masticatory system, and they're less likely to choke. They learn proper swallowing patterns. They have more strength and more tone. We're actually creating higher choke hazards because we just don't have the tone. They're not chewing. So the choke risk is actually higher in our culture than in cultures where they just like eat raw fruits and vegetables and pull the meat off the bone. So I've been telling parents to eat.
Little ones will gag more than choke. It's parents,
Yeah.
like that.
Oh, they see that. Yes. They
Yeah.
gag and they gag.
Yeah.
I've been telling parents to use the baby safe feeder at least to put some food inside that net to chew on it. I don't know if you have any recommendations for parents to.
Never heard of that. That's cool.
It's a little net on it screws so you can unscrew this little tiny net and you put.
Is it necessary? I don't know. I guess I like
Right.
lead weaning. I tell parents to start to introduce soft chunks of food like avocado, banana. Tell the parents get confident, right?
Yeah,
And
they
then,
got to get confident first.
steam or microwave or whatever you want with the broccoli florets so that kids are literally mowing on foods. And I show them a video of my niece eating everything we ate at Christmas at a Mother's Day dinner, where she's literally pinching and mowing, and like it's messy eating because they're experimenting, but they're also experimenting with a diversity of tastes and textures. So we're teaching them not to become picky eaters.
Yeah,
And
and that's another thing we have in this society is yeah, my kid will only eat chicken nuggets and French
applesauce.
fries and applesauce. And I'm like, well, it's not the best. Um,
Well, kids will eat whatever you put out because
right.
they don't have a credit card, right?
Isn't it right? Truth. Yeah.
They'll eat when they're hungry because that's what humans do. And it's us that have decided that we're going to raise our kids on kid food.
And you know what's, it was so neat when I watched this video you put out of this little girl who went home and I guess it was 2 weeks into her journey of starting to eat healthier. I think you showed the video at the ADA, and I think she had a plate full of asparagus or something like that. And she was so excited to show you.
So good. Yeah.
Yeah, and how good it is. And she's eating that asparagus. And I'm like, oh, I love it. It really is.
It's not a couple weeks, but she was one of the kids who we helped coach from Annie's mac and cheese and applesauce to real food. And she was making a video for me about how much she loved her new vegetables, right?
It was just really cool. It was cool to see the child actually, I mean, they're dying for us to show them the right way, right? They'll do it. They're pleasers. So let's.
But now we have a generation of parents who were not raised in a healthy way themselves. So they're not modeling that behavior either. They're eating packaged foods all day long.
That is so true.
That's been a little bit of an issue where
we're a few generations in now and they're just getting sicker is what's happening.
Right.
And, and we already have a lot of mom guilt flying around right now in life. And it's like how to do this, not shaming people, not judging, walking alongside them, showing them a better way, showing them a different way, letting them make some changes and informing them. Do you have educational platforms for dentists to teach? What are some platforms that people can find you on to learn more about this?
So, we mentioned the Brave Parent podcast is by the way, episode 11 is the one.
Thank you. I was going to ask, what episode is your son's?
Because people want to, if you're raising kids and you're listening to this and you want to begin with the end in mind and see what does it look like when a 29-year-old kid thanks their mom for having a weird household, right? It gives you some hope. Total Health Academy is the academy that I created online. It's an online learning platform. We're just about to change the pricing of that from a package deal to a monthly deal, so you can get in and try it as a membership. But it's so stay tuned for that. But it is it's an A to Z. It's like if you went to a restaurant and opened a menu and decided, what am I hungry for first? So you can really self-pace it. It's for you and your members, so you can learn together. It would create 5 to 7 years of solid dedication to create a total health practice from infancy to elderly. But it's doable in chunks. And as I started out saying, part of this journey that makes it fun is learning, not being the expert, is learning together. And so if you're going to end up doing perio bundling and diabetes detection and cardiovascular, half of our patients are referred to us by the medical community. You want that kind of a practice, it's totally doable.
And this isn't and I love it because you're free from insurance. I mean, you're practicing the way you want to practice. And then for clinicians that are more wellness based, I mean, you could have your 5-year goal out and say, look, this is what I want to be in 5 years. I want to incorporate this in 5 years, be free from the insurance companies, helping patients, collaborating more with my medical colleagues, learning along the way.
And you might think that we're able to be insurance independent because we live in a big metropolitan area. I'm a very, we went insurance independent, Independence Day 2000, but also the hands-on learning lab for children is that old too. We were already straying away from traditional care and giving more to families. People drive from all over for the experience for their kids to grow up learning more. We have 46 of our patients are now practicing dentists. So they graduate high school having, placed a sealant on a real tooth in the lab and taken an alginate of their own mouth and poured it up and looked under a microscope and screwed an implant into a model. But there's all kinds of health related activities as well, not just dentistry. But I will say that Total Health Academy will help you take a step in whatever direction you want to go. If you want to start with pediatric airway, it's there. If you want to start with salivary diagnostics for perio, if you want to start with being able to detect reflux or food sensitivities or nutrient deficiencies or fungal infections, it's there. Again, once you see it, you don't get to unsee it. So it's about layering on all those things. People come up to me all the time and say, after watching me speak for 6 or 7 hours, like, I want this. Where do I start? I go, what was most interesting to you today? Like, why don't you start there? Because it's usually personal.
Yes, it is.
It's usually like, I had no idea that I could solve this problem in me or one of my loved ones. And so I say, start there, because if you're on that journey and you're excited, you'll take your patients with you. And it is not a sprint.
Isn't this the truth?
I'll give you something that in 6 months will revolutionize. We're definitely adding a value to the hygiene visit. We're definitely adding different revenue streams and things like that. But it is not about how many oral appliances you can make for the advanced sleep apnea patient. Yes, I'd love for you to be able to make a good appliance, but that's end stage disease, right?
Yes.
Time, and how can you profit and benefit from that as a group? And moving away from third-party influence is not about money. It is about not allowing third parties to dictate that doctor-patient relationship. It's about being seen the way you want to be seen in your life. It's about getting away from, when you think about the 6-month prophy, why do we do 6-month prophies? Because insurance allow it. If tomorrow morning they say we're only going to pay for it every 8 months, we'd probably switch to 8 months, and we'd be mad about it. And we would talk about how bad the insurance company is. There isn't any efficacy in 6-month prophies, and the insurance companies know this. The reason they keep that 6-month, when I say that, they study this. People who see the dentist every 6 months are no healthier as a whole than people who don't. And the insurance companies know this. They do it because they don't want to take away benefits from their clients, right? So if Oldsmobile is, or if GM, General Motors, is meeting with a third party, they're advocating for their employees not to lose a benefit they already have. But the fact of the matter is, we should be waking up and making that 6-month preventive visit something important so that they recognize that this is an important part of healthcare. How sad that during COVID, we were seen as a what do they call it? Non-essential.
It was elective. I mean, it was like we're not an essential healthcare provider, only the,
the system.
And we saw disasters as a result of it.
Our place there. We haven't earned our place there. We saw disasters because their lifestyle declined and we weren't there to diagnose and pick up the pieces. But again, diagnosing holes in teeth and
exactly
is not what I'm talking about. If we could have during COVID said, look, we're recognizing the people that are getting sick and dying are really sick to begin with. And where does dentistry fit? The nurse practitioner, the physician's assistants, the dental hygienist. The dental hygienist should be right there with
mid-level providers, with all the nurse practitioners and PAs. Agreed.
That preventive visit and make it something extraordinary.
Agreed.
And that's what you can do for your patients, right?
Agreed.
Yeah.
Well, Susan, I just so very much appreciate this. I love talking to you. We could talk for 7 more hours on this because I just learned so much from you, and I just respect everything you've done. Will you tell everyone the website, that how they can reach you? I'll put it in the podcast links as well, and all this information. But how can people reach you?
Email address is susan@drsusanmaples.com. So that's easy enough to reach me personally. If you Google me, you'll find me. drsusanmaplesspeaker.com if you're looking for me to be part of a speaking opportunity, or you want to bring me in for a day on total health for your study club or something like that. I'm happy to discuss that. If you want to take a look at my practice, it's Total Health Dentistry, Total Health Dentistry is a good way to find me. Just Google it. And also in Holt, Michigan, and also you can Google the Total Health Academy and get online and see what that's about. If you're interested, email me because I'll send you the new pricing sheet too. To jump in as a member, you can get in pretty inexpensively now to take a look at it and try it out for a few months and see if it's something your team would enjoy. So I appreciate you and all of that. I'm just here to help people take bigger steps. The Brave Parent book is available in Audible and also in written form. And
there it is. Yes.
Look up beabraveparent.com. and see more about that. It's an A to Z health book. It's not just on airway, but there is a big section on breathe, which is airway development, and a section on sleep, which is sleep-related breathing disorders, which ACEP pathway is really all about. So there's also one on digestive health, nutrition for kids. There's one on food. There's one on daily exercise, a whole section on drink, what to drink, if anything, besides water, and even there, what kind of water and what's going on with sparkling water and vegetables.
Oh, that's a whole topic there. Yes.
Yeah, there's a lot there.
I'll put all the links. I'll get those links from you, and then I'll make sure they're in the podcast. So anybody wanting to circle back and look in the transcript or whatever, they'll be able to find it. I like to end talking with people, just kind of journey back to your childhood. So I like to ask you 3 questions. So one would be, what was your favorite activity when you were a kid? Your favorite like game to play when you were little?
I did a lot of activities. I probably was ADHD as a child. But I think that I was most creative. I enjoyed being creating art. So at my easel, working with
Ah,
jewelry, doing pottery, clay. I think I just enjoyed like artistic endeavors on
do you
my own.
still do that?
Oh yeah.
Good for you. Good for you. What is your favorite color?
Oh, I don't know. That's a really good one. I love an array of color, and I try not to pay any attention to what color looks best on me and what doesn't. I think colors is awesome. So I think
So for you, is it more like it depends what I feel for the day?
yeah, and yes, I think so. Earth tones. I like sort of bluish greens, like
I'm
this.
kind of getting that vibe in your house right now.
Well,
Yeah.
one, yeah, but I have a red kitchen at home. I'm not at home right now. I'm in Florida, but yeah. So I like color.
What was your favorite cartoon growing up?
I didn't watch TV much.
Really? Good
Not,
for you.
and I didn't raise Hunter watching a lot of TV. So I can't say that I ever really watched cartoons, but I loved like Charlie Brown,
Mm,
Easter, and those kinds of things. I didn't have any regular cartoons.
I love Charlie Brown too.
Yeah.
Loved it. Well, thank you so much for coming on today and letting us hear more about you and what you're doing, all the amazing things you're doing in Holt, Michigan. And I'd love to have you back sometime and talk more about.
Palooza, New Orleans.
Oh, I won't be there.
Oh shoot.
I won't be there this time. Oh, I'm talking to Lauren about going next year, 2025. So we're working on that, and we're working to get ASAP Pathway out there, Airway
Yeah,
Palooza. Yeah, it
well,
is an amazing
March,
event.
I think it's March 15th through 17th or something like that. And this year, Shireen Lim and Sharon Moore are coming over from Australia. Sharon wrote Sleep Right Kids, and Shireen wrote Breathe, Sleep, Thrive. And so if you're at all interested in being there, there's a whole day of pediatrics and a whole day of adults. And Lauren does an amazing job with that
She
meeting.
does. I love Lauren, and she and I keep talking, and it's like, how about this year? And then we're like, we're already going to be here during the time you guys are going to be in Louisiana. So 2025, we have it down. Like ASAP's got to be part of it. And I love Shireen Lim. I'm going to have her on. I've got her scheduled, I think, next month to talk because she's doing amazing things. Sharon Moore is amazing. We've just got so many great people in this community with us.
That say like, I want to do this. I want to help. And, the thing is, I think the big deterrent is that you don't need to be treating all these kids to help. Treatment you may want to do, but you got to be recognizing them and helping look for solutions in the world or community so that these kids can get the help they need. Yeah.
Amen to that. And again, I'm blessed to have you in my life. I'm so happy to be on this journey with you, Susan. And I know you're busy. Thanks for sharing your time with us. And everybody check her out. She's amazing. I love you.
Thank you. Wow.
All right. Bye, everybody. See you next time.
Bye.